This is ASAP Pathway. Hey friends, welcome back to another episode of ASAP Pathway, the podcast. I'm your host today, Dr. Stacy, and I have the honor of bringing this wonderful person to you. And I really hope you enjoyed today's conversation. We've already pre-recorded. We had a little bit of tears shed and some mutual passion expressed on this topic. But today I have Kelley Richardson with us. Hi, Kelley.
Hi.
Just so thankful that you're here today, and thanks for taking the time. And I really wanted to let the world hear your story, because I think your story, as we were talking before, Kelley, your story and my story, we have some similarities, right? We have some commonalities, and I think there are a lot of other families out there that might share that with you. So I'd love to introduce you if that's okay.
Sure.
Okay. Kelley has been in the dental world for over 25 years. She was a senior dental product specialist, restorative products, for 10 years. And she's spent the last 15 years as an account executive in the aligner and occlusion space. She also leads an Airway study club where she brings together different healthcare professionals to collaborate on airway-related issues. But it was her 3 years at the Dawson Academy as an Airway curriculum liaison that inspired her to create the children's book, The Very Stuffy Nose, to alert parents about the hidden impact of mouth breathing and to encourage little ones to focus on habitual nasal breathing. So welcome. It's so funny. I saw you. I mean, you and I know each other through ASAP Pathway. And you have this trailblazing history that predated you and I knowing each other in ASAP Pathway. But I saw recently on LinkedIn just something about your book. And I thought, Kelley's got a book? What is going on? Why do I not know this about you? So I thought, I reached out and like, you got to get on here and let's just talk. And so I'm glad you agreed, and I'm so grateful that you're here. Do you mind? I mean, you and I, we've both been in this arena of Airway, kind of, navigating our way for a couple of decades. And, it's been quite a journey. Things have changed a lot in the last couple of decades, especially the last 5-10 years. I love for you to share your story. Like, where did you start in dentistry? How did this journey start for you of airway health and mouth breathing awareness and all of that?
Yeah. So in high school, I wanted to be a dentist. And I had such a great pediatric dentist, and I had a really great orthodontist. And so I just always felt comfortable in the dental space, and it just was where I wanted to be. But chemistry was not my strong suit. And so I started realizing that the business school was really more my forte. So when I went over into the business school and got a degree after I had worked for a couple of years for a company, I was sitting there and kind of lamenting that I wasn't in the dental space. And then when I had been an assistant in high school, there was this moment where this lady came in, and I was at the front desk, and she was selling gloves. And so she came in and asked if I would get the doctor to try out her gloves. And so I go in, and then they have this exchange, and he buys some gloves. And I'm like, that's really great. And so it's like years later, I'm like, oh, I could be on that side of dentistry. And so that was my journey. I worked for 10 years as a senior dental product specialist. I was selling composite materials and bonding agents. And one of my specialties, I really loved the clinical side of things. So I learned really so much about the flexural modulus of elasticity for class 5 restorations. And so
It's the nemesis of all dentists is we want to make sure that class 5 composite has enough flexural strength that it can withstand the forces.
Yes. And so for all these years, I realized, like, after I got into the aligner and occlusion space, that's where I realized that the fremitus, the flexing of that tooth that actually caused the enamel to come out is really an occlusion thing. And it's an airway thing because so many patients have the muscles, the tongue wasn't in the roof of the mouth to develop a wide arch. So now we've got the muscles of the cheeks pushing everything in.
Hey,
And now,
Kelly, for a second, can I just explain to like the average person listening that may not know what a class five? So
yeah, yes, please.
class five. So for those of you watching the video, that's just kind of more of a location on the tooth. So it's towards the gum line, basically. And what she's describing is like ditching out. So if you took your fingernail and you rubbed, your tooth should be nice and smooth all the way down to your gum line. But if you have what's called an infraction, which is where there's this chipping away at the gum line, it like literally chunks of your tooth over time start to, chip away, and it's like a wedge missing in your tooth. And so for a dentist repairing that, it's very hard to keep a material that will withstand those kind of forces. So we got all these chemists trying to figure out the best way to come up with a material that has good flexural strength for that area, that location that's taking those kind of bending forces. But in reality, if we could just potentially maybe get people in better occlusion and hopefully stop the parafunctional activity or the activity that's causing it, which is bruxism and clenching and, teeth being tipped and this whole thing you're describing. So if you want to like feel around by your gum line, you might see if you have an abfraction to the listener.
So many people have it, so don't feel bad if you have one. They're common.
They
So
are. They are. So continue with what
yeah.
you were saying. I just wanted to stop and let someone listening right now was like, "What are you talking about? A class five? What?"
Right. Yes, exactly. That's why you're so good at this job,
Oh
is
no.
that you can take this and you can
No,
really
ask
boil
me
it
how
down
I
to
know. People will, say, "Hey, sometimes you guys talk about stuff that we don't know what you're saying." I'm like, "Oh, it's shoot. Let me back it up a little bit." So lessons learned
yeah.
myself over the years. So go ahead, Kelly.
I love it. I love it. So, sure. So, when I was at the Dawson Academy, one of the things they were so generous to let me do was to take the courses as well. So, I was able to go have my own study models in the occlusion curriculum and be able to really understand how what you need to do restoratively to get teeth in a better biting position. And I've been with aligner companies since 2005, and understanding how when the teeth are tipped in, the tongue wasn't in the roof of the mouth. And so ultimately that sets someone up for less tongue space because the tongue is low. You're not developing that wider arch. And so not only are you now going to potentially have a breathing issue while you're sleeping, but you're also going to have dental arches that develop more narrow. And so in the aligner space, we spend a lot of time. My current company is really particular about helping the doctor get the arches back upright to improve that occlusion. And in that improvement, you're going to be able to allow the tongue to have more space. And then when we talk about breathing, specifically a nasal breathing, you cannot breathe through your mouth if your nose is in the palate, is in the roof of your mouth. So we want to be able to get that tongue up into the roof of the mouth to be able to block your ability to breathe through your mouth, because nothing good happens when you're mouth breathing. You're breathing in toxins. You don't have the benefit of the air being warm or filtered or humidified. And you also don't get the benefit of the nitric oxide that is created in your sinuses, your paranasal sinuses, to help clean up that as an antibacterial and antiviral, and to be able to help you go into a rest and relax state, to be able to take that air fully into your lungs all the way down to your diaphragm so that you can then fill up your lungs better.
I was going to just segue into that. Karen Parker Davidson is someone I just really recently
Love her.
connected with, and she and I nerd out a lot now. just
Yep.
randomly through texting.
Yes.
So, but she's got her new book is coming out, The Nose Decoded. But she's like, hey, girl, I'm up to like 63 functions of the nose and counting. And I'm like, what the heck? But one of which, we underestimate the importance of the nervous system and or our central nervous system, the autonomic nervous system, regulation of sympathetic tone, parasympathetic tone, and how now we know breathing does affect how calm of a state we are in. This has been thousands of years of certain meditative states are breathing is so important, and but that diaphragm engagement and that vagal tone and stimulation is so important. And even just, certain sides of the brain being stimulated from nasal breathing. There's so much there, Kelley. But I'm going to back it up a little bit because we went from you're working with composite
Hmm.
and all of a sudden you're talking about nose breathing. And it's like, what on earth? That is not a typical transition for someone in dentistry to gain that type of awareness about nasal breathing and all the functions of the nose. So
Yep.
what was your journey like? You went from, I think you said you used to work with Invisalign, or you were a rep with Invisalign, or what's the journey there that got you into this understanding of airway health and the importance of dentistry within airway health?
Yeah. So when I was at Invisalign, so I went from this dent supply where I was selling composites, and then I was then hired by Invisalign. And at Invisalign, we were creating some local study clubs up in the New York area where ultimately we were teaching the local doctors how to upright the teeth and put the teeth in better occlusion. And so I understood the idea of expanding arches for occlusions purposes. But when I was at Invisalign, that's when I had my son, and he was a healthy child. We just had a lot of trouble with his latching from day one. And so I over that first year of trying to nurse, it wasn't working. So we went to bottle feeding, and this just seemed within the first week he was losing so much weight. The pediatrician said, "Oh, here's some formula. You'll just do that." And I thought, well, okay, this doesn't seem to be anything out of the ordinary. Nobody seems to be mentioning it, and this is now looking back, I didn't realize that you can have these gag orders on lactation specialists in hospitals
Hmm.
because the lactation specialists were telling me, well, you're just doing it wrong and you just need to adjust and all of that. And I'm thinking, I can't be doing this wrong. Like there's this, I didn't take all the courses, I just thought, I'll just have a baby, it'll be fine. But I do think that this is a pretty straightforward procedure to feed my baby.
Right.
And it just wasn't working. And I just remember like day two, I think it was, where he was not doing great. I couldn't, he wasn't feeding, and I just stopped listening to everybody. I took that bottle that was in his bassinet and I stuck it in his mouth, and he just started sucking. And I'm like, okay, this is good. I think this is the option that we have to take. But what I didn't realize is that an IBCLC or lactation specialist in a hospital is not going to be the same as somebody outside a hospital that would say, we should identify if his tongue doesn't isn't is tethered in a way that's not allowing him to actually effectively breastfeed. So because I didn't know that information or even think to look outside, then I just for years my child had the symptoms of tongue tethered tongue, a tongue tie, gag reflex, and all of the things that would keep him from being able to, really develop in a way that would help him sleep well. So for the first year of his life, he would toss and well, for 6 years, he tossed and turned during sleep. He never really fully slept through the night. until we had an answer when he was 6. But because his tongue was low in his mouth, he was a mouth breather. He just habitually was a mouth breather from birth. And that's because when your tongue is not in the roof of the mouth, forcing you to breathe through your nose, it's pretty easy to breathe through your mouth. But when my child would go to sleep, he would not only toss and turn, but he would sweat
Mm.
so much that the most durable diapers were disintegrating. And it was just mind blowing because my husband and I were like, well, I don't think it's all pee. And I have no idea why these diapers are breaking down. But one of the signs or the symptoms of disordered breathing while sleeping is that your body is sweating profusely. It's in an alarm state. It's in fight or flight because as the tongue is being pushed back into his airspace and and it's telling the body to come out of the deeper levels of sleep, then his body's symptoms are showing me. So he had even asthma or not asthma, but
Acid, did he have any acid reflux or anything like that
He
with it?
did.
No.
He had acid reflux. He was a gagger.
Mm.
So I was filling up his lunchbox with these pouches,
Yes, because you're like, this is the only thing
draining
my
his
kid
mouth.
will eat,
I
right?
don't want him, I don't want, if he's going to gag on something that's a little bit harder, I don't want him choking on something, which happened when he was at daycare. He choked on a raisin, and, this amazing daycare worker swoops in and gets the raisin out of the back of his throat, but he just didn't have the function, the swallow function that was working properly because his tongue wasn't in the roof of the mouth from the beginning. And so that's what sort of set us up with 6 years of him truly not getting into the deeper levels of sleep. And for all that time, we had allergy tests. He was not allergic to the cat, or he just had a dust allergy, cockroaches, but nothing that would indicate an inflammatory state. That so the we had him scoped. He didn't have adenoids or tonsils that were enlarged. Oddly enough, because the connection from mouth breathing tends to be to that local inflammation and then potential enlargement of the adenoids and the tonsils, but that wasn't his situation. So what the whole thing that I found out later in Airway is everybody has a different set of symptoms and signs. But the one thing that I did learn is that when the tongue is in the roof of the mouth, it's going to force the nasal breathing. And after a week of forced nasal breathing, you're going to be able to breathe better through your nose. And then you and I both have done the training, the Buteyko method, to learn how to breathe lighter so that if your nasal passage isn't optimal for breathing through your nose, if you have some obstructions, you can still learn to breathe through your nose comfortably enough by slowing down your breathing. And that's going to create that diaphragmatic, deeper
Yeah, because there is, I
breathing.
mean, we do want to involve the ear, nose, throat doctors and have an evaluation. What in the world's going on? Oh my gosh, like last week I did a cone beam on this uh young woman. She's in her 20s, and I said, "Do you have a hard time breathing through your nose?" Because what I saw was very interesting on the cone beam, but it was probably one of the biggest nasal spurs I had ever seen. This bony, it actually shot out of the left side of her septum, looked like a giant triangle, and it went into her left maxillary sinus. Anyway, it was huge, and
Wow.
I was one of the biggest I've ever seen. So I said, we're gonna get you to the ENT, just have an evaluation, but I'm curious. Do you have a hard time breathing through your nose? She's like, my whole life. She's like, especially if one side gets obstructed, like when I'm sick, I'm like, forget it. I can't breathe at all. I go, well, let's get you to the doctor. But if there's any resistance, the body is like, okay, it looks for an alternative. And especially in childhood, like if a kiddo gets sick, what can
Yep.
happen is their nose gets obstructed, and you know, they start becoming mouth breathers through the illness. But sometimes, even when the nose opens again, they've sometimes just developed this pattern of breathing through the mouth. So there is an aspect of sometimes it's retraining, sometimes it's turning the nose back off on that's been turned off. And it's funny because I heard Christian Guilleminault say once at one of the ADA meetings that literally a nose can be shut off, and and everything that goes with it. The brain needs to be communicating with that nose. There is a lot. That's what, when I was talking to Karen Parker, KPD, Karen Parker Davidson, she's like, there's so much we're learning about that communication between the nose and the brain. It goes beyond smelling. It even goes beyond the three things we talk about: humidification, purification. It goes beyond those things
Mm-hmm.
that, if you think about it, this nose of ours sticks out further than anything on our body, the front of our body. Like the nose should, it's ahead of us for a reason. It's,
Yeah.
you know what I mean? Like if the
Yeah.
nose, be interesting if the nose was flat on our face. That's not
Yeah.
how it is. And some of us, like myself, our nose comes out a little further than others, but I, but it's like, there's a reason for this.
Yeah.
There's protection and awareness of our surroundings. And the nose is like, look at other mammals, how
Yeah.
they're sniffing. They can smell their predator coming. They can, the nose has such a protective
Mm-hmm.
aspect to us.
Yes.
And things we're just now even learning,
Yeah.
with sympathetic tone and, a calm state. People are
Mm-hmm.
walking around mouth breathing in these panic, brain fog states. It's like, how many people are walking around like that? And, it's like, if we could just talk more about nasal breathing in a primary care visit or a primary care dentist visit. And I think hopefully that is the future. Hopefully we are talking about that more when more research is coming out about the role even of the tongue with the nose. And oh my gosh, it's an exciting time, Kelley. But so you get into this because you see stuff with your own kiddo, right? And you told
Yeah.
me earlier, it's like, which I mean, my poor kids, I talk about them all the time on the podcast. I'm like, I talk about them all the time, but they're my why. They're the whole reason I'm doing this. And it sounds like you have a similar journey. But you
Yeah.
said you had 6 years
Yep.
of no
6 years.
answers.
I had no answers. I had no idea how to help him sleep. And nobody in the medical community had shown any sense of alarm or really direction that provided an answer. It just seemed so normal.
So let me
And
ask you, did you ask the pediatrician, like,
yeah,
my kiddo, he's flopping all over the place. He
yep.
can't sleep through the night. He's soaking the sheets. And what would they say back?
So she said, "Well, there's this great little device called the Nose Frida, and it'll help you clear his nose, which is helpful because part of breathing through your nose is if you're breathing through your mouth and everything is getting clogged up in the nose, you really need to have great nasal hygiene." So that was a suggestion, but there was never a conversation about sleep. And ultimately, what I am starting have learned is that when you have an obstruction during sleep, especially that's going to when you start to relax and your tongue is attached to your mandible, and when things relax and your mandible can relax into your throat, that alarm system is going to tell my son to move. And when you're a kid, you're more sensitive to it, thankfully.
Right.
So there's a lot of movement. So what I've learned is that the question isn't how does your child mouth breathe at night? Because if they're mouth breathing at night, which Christian Guilleminault said with in um, all of his research, is that if a child is mouth breathing at night, then you have not cured your child. So the important part of that is that the mouth breathing hinging into and the mandible hinging into the airspace that's sending the alarms for the child to move and move and move, where they're so restless that the bed looks like there was just like they've been playing all night. When honestly, what's happening is they're just not getting to the deeper levels of restorative sleep where they're taking what they learned during the day and putting that into long-term storage so they can access that and build on the layers of knowledge to then be able to learn things like their alphabet and then starting to put things together and start to read. And so when they don't spend as much time in that deep restorative N3 sleep, then they're not getting the transfer of short-term knowledge into long-term knowledge. They're not clearing their brains as of the toxins. So the glymphatic system, we know that in that first 4 hours of sleep, that you're spending more time, or most of the time in N3 is in that first half of your sleep, if you're getting an 8-hour sleep cycle. So you're not benefiting from the restorative sleep where you're restoring energy. Instead, you're getting cortisol that's pouring through the body because the child is really just trying to breathe.
Well, and right, and this, there's so much to unpack just in this discussion right here about, N3 sleep and the importance of, I mean, we're learning now, I mean, we knew this. A child that isn't sleeping well and getting proper, they're not going to get proper growth hormone release, which is during stage 3.
Yes.
That's when growth hormone is released.
Yes.
And when you're an adult, that's when repair. So growth hormone helps a child grow and repair, but for an adult, it helps us repair. What is more recent is the recent discovery of this whole glymphatic system, right?
Mm-hmm.
So we've got this whole pump system going on in the brain where this is a time to cleanse and cleanse the brain and get all that stickiness out of there. And it's really like primary respiration. Like when they actually do a time lapse on the brain and you watch the fluids when they speed it up. I mean, it's literally like, it's like, sorry, I'm making all these noises and people can't, if you're not watching me right now, I'm making a pumping my fist, but there is a cleansing effect. So what is interesting, I was talking to Kevin Boyd, I guess it was about a month ago, and we know that there are executive function issues in children that do not sleep well. Sleep fragmentation, whatever the cause, poor breathing, movement, doesn't matter.
Right.
Any sleep fragmentation is going to affect executive function. We know that oxygenation issues affect certain parts of the brain more than other issues of just sleep fragmentation, period. So sleep fragmentation and poor oxygenation, they do have different aspects of how it affects a child's brain, but nonetheless, it's not good. But we know that there's studies coming out now that we're connecting Parkinson's to poor sleep. Dementia has long been, connected to poor sleep, and the more fragmented sleep you have, increasing your risk of dementia. And, there's different medications out there for sleep, like diphenhydramine, certain medications, ZQuil, which is basically Benadryl, diphenhydramine, chronic use of that, because it's fragmenting sleep. It feels like you're getting better sleep at first because you feel that sleep pressure. Anyway, it's so interesting that they're now saying, we're looking at poor sleep in adulthood being linked to Parkinson's, dementia, all these neurodegenerative diseases. But what's interesting is we know there's neurocognitive deficits in childhood.
Yep.
When does this start? Could the Alzheimer's, Parkinson's propensities be connected at even a younger age? Could we be preventing something in children way long term that we're not even aware of? Not just helping a child with neurocognitive deficits, helping them be better in school, but are we setting them up to potentially have a better outcome in their life long term.
Mhm.
It's so hard to say, the curiosity is there, the question is there, but we also know life is such a journey. We can help a child at 7, 8, 9, 10, and then all of a sudden they hit a hiccup at a 12, 13, 14 in their life, right? So you never want to say, okay, we have helped a child, now they're free and clear the rest of their life.
Right.
Can't say that because they could gain 40 pounds at 20, or I mean, who
Absolutely.
knows? They could
Yeah.
get an allergy to a cat and go to become a mouth breather at
Yeah.
27.
Right. Absolutely.
But you've got this beautiful window of opportunity by age
Mhm.
6 to make such long, we have David Gazal's studies showing that children that were in the bottom third of their class
Mhm.
at 13 years old, they don't snore anymore, but they did between the ages of 4 and 6, So it
Mhm.
doesn't, there, we know early intervention matters, Kelley. And so you were watching your kiddo
Yep.
struggle and you're having this awareness in your journey. So you have this connection. I know you had a connection with um, Bill Hang, Peter Beckwith. I'm going to name drop some
Yeah.
of my I love Peter
Yeah.
Beckwith, some friends out there, Ben Moralia.
Yep.
Uh, and I don't believe in coincidences. I just don't. So I think our journeys and our paths take us on, you know, we cross paths with people on purpose and as we're supposed to at the perfect time. So here you are making these discoveries. When was your aha moment? Like you are like, no one's helping me in the medical community. What the heck?
Yeah. And so it was during those 6 years where I just was looking for answers and not finding them and thinking, I am going to find an answer to this. I know that we're gonna solve this, but I just wasn't able to do it on my own. So we had moved from New York to Florida at the time. It was late one night and I was looking on LinkedIn because when it's really quiet at night, I can get a lot done. So I was looking through, trying to figure out what's my next job opportunity. And one of the posts came up that said, if your child is a restless sleeper, has some learning uh, difficulties, and is, oh, something else. There was one other sign. Then you should reach, then an airway dentist may be able to help. So at this point, I think I was in the industry for probably up to 20 years, and I had never heard about airway dentistry. But this post was from Dr. Bill Hang, and I didn't even know Dr. Bill Hang. But what I later found out is that Peter Beckwith and was helping Dr. Bill Hang get this message out there. So he's in California and I'm in Florida. This post pops up and I'm thinking, I think I have an answer. It
What
was
was the
just
post? What was the post? What did you see?
it's the post. All it said was, if your child is a restless sleeper, has difficulty breathing or sleeping, and oh gosh, one other part. It was or and has hyperactivity. And Finn had a lot of energy as a child. I didn't think that much of it, but for sure he had a lot of energy. So I thought, this he has all of that because he was in pre-K 4, so he was learning the alphabet. And I thought, the alphabet's a pretty easy thing to learn, I think, because of all the songs that you can sing and all of that. But he was having trouble completely getting it down. So I thought, okay, yeah, so he's probably in all of those categories. And so I thought, all right, there's airway dentistry. I have no idea what that is. I've been in this space for, like 20 years. And so I go, but I knew that the ADA was being held in Atlanta that year. And so I go to the site and I look it up, airway dentistry, and there was one speaker that year, and it was Dr. Ben Moralia. And I had worked with Dr. Ben for 7 of my 10 years at Invisalign. He and I had been creating all this content, teaching the local doctors in New York how to upright teeth and get better occlusion. And it was less reductive because a lot of doctors don't like to cut the teeth to straighten them. So everybody was loving this message. Well, it turns out that Ben continued down that path after I had left Invisalign and had lost a little bit of touch with him, that he was starting to realize that when he was creating more space to upright these teeth to get patients in a better biting order, that his patients were breathing and sleeping better, anecdotally. So that's when he was continued down this journey that I didn't realize he was on. So when next day I called the office and had a chance to speak with him, and within 5 minutes he knew the questions to ask. And I said, and honestly, I was like, yeah, well, when his mouth is shut, he looks like he's got a big overbite. That's what, as a parent, would call it. We know it's a class 2 malocclusion. But when his mouth was open, he looked like he was class 3, where his like Jay Leno. So it would hinge out. And I'm like, how can he be a class 2 and a class 3? I'm just like, how can he be both? But what we now know is that he was adjusting to get his mouth closed, but when he was mouth breathing, and this, because his maxilla, his upper, the bone that houses the upper teeth that come right up under the eyes, that wasn't being pushed forward by the force of the tongue. So the tongue needed to be in the roof of the mouth to help him nasal breathe, but it also needed to be in the roof of the mouth to push that maxilla forward. And a lot of this I learned from taking the myofunctional training, because we didn't have Zoom back in the day. So he needed a myofunctional therapist. Well, that was going to be me. I'm going to go take the coursework.
You're like, I'm going to go learn this myself, which is so interesting, because a lot of people in this, right, over the years that I've come across, we're in this because we're trying to help our kids, right? And
Yes.
I have this meme, and a lot of people that have heard me lecture, I always throw this slide in there, and it says, a worried mother does better research than the FBI. And it's so true, because we are genetically, our DNA is like, we are warriors for our children. We are fierce. We will do whatever it takes to help our kids. And so a lot of us are like, I'm going to go learn it. It's why I did the Buteyko breathing. That's why, I co-founded ASAP. Because I was so,
Yeah.
I couldn't believe how hard it was for me to get the answers I had.
Mm-hmm.
And Michelle, Tracy, and I had talked over, we're like, this shouldn't be this hard for someone to get this kind of information. And so we thought, well, wow, if we can create something so that it would be easier for other dentists that are looking for this information. But so so we know how you got into this, very similar to what a lot of people do, which is something personal, a personal journey that gets you into this field of airway health from dentistry. And I think it's exciting. I know Audrey Yoon is at Pacific Ortho Residency. Now their ortho residents have to include sleep is included, sleep training is included.
Love that.
Yeah, so it's happening. It's just it's gonna take a minute. But I saw her post actually. Actually, I think it was yesterday. She was at the ADA Airway Summit. So the American Dental Association brought together people from all over the world to have open forum discussions. And so it's happening. Things are changing. It feels kind of like lightning speed right now. So it's like, hold on, it's here it comes. It's like we've been trying to get this information out like with a water hose, and now it's like someone just busted open a fire hydrant, and all this information is pouring out at us. And it's like, how do you decipher? What do you do with the information? So here we are, you've been in this field 25 years. What are some good changes? What are some, you've written the book, The Very Stuffy Nose. Your goal is to educate parents, and really, I think, this is why within the podcast too, I try to talk, the listener might be a parent. I get patients in my practice. They're like, I heard your podcast. But it's really the parents, the families, the public, they're going to drive,
Hmm.
hopefully, their local community of medical practitioners, healthcare providers to start understanding and learning more about this. And, even if like, I might get someone in my chair, someone in my office and they've been to X, Y, Z, A, B, C dentist,
Yeah.
or ENT, pediatrician, and still have no answers. And they're frustrated because they don't know which ENT to go to. They don't know which dentist to go to,
Yep.
because not all dentists are trained in this, and not
Right.
all ENTs have a very comprehensive view of this collaboration as well.
Hmm.
But let's try to spin this a little bit more positive. So we know the journey's been long, it's been
Yep.
tough, and it's still tough. But what are some good changes that you're seeing now that you're like, wow, I wouldn't have seen this a few years ago?
Hmm. I see the trend of more curiosity and awareness around breathing and sleep. And in the dental industry, it may not be every dentist is doing airway, but they're curious about airway. And when I have somebody in an area that I'm talking to a mom that a friend referred to me and we're having a conversation and I don't know anybody in that area, well, the first thing I do is I tell them to look on your site because you have a great provider locator of an airway provider so they can come to your site and find that. But if I don't have anybody, then I want to start with the myofunctional therapist because they are the ones that are connected and they're going to be able to tell you who is going to be able to do a functional frenuloplasty if that's what they need, or who is the dentist that they partner with. So I find, or they may be a myofunctional therapist, but you need a lactation specialist or breathing and feeding because that's what happens before you start getting into the myofunctional therapy. So that's I think that there's so many hygienists that are opening up the door to myofunctional therapy as an adjunct and or a side hustle, and they're starting to see because in the hygiene chair, the hygienist has that knowledge, and they have the ability to see what's going on in someone's mouth, and if they see the teeth are tipped lingually, and they see that there's a low tongue posture or just a lot of cavities because the dry mouth from breathing through the mouth, then they can start connecting the dots.
Yeah.
So I'm super passionate about training hygienists on what to look for and how to even start that conversation, and and then kind of going from there.
Well,
But I think the hygiene, you see your hygienist twice a year, hopefully, more so than you would see your physician. So, and that relationship is such a lovely relationship
it
because
is.
the hygienist just cares. They all these hygienists have this like personality type of just caring for their patient. They're very caring individuals.
Well, I'm a big fan of hygienists.
Yes, you are.
I used to be a dental hygienist.
Yeah.
And so I am, gosh, and I agree, they see the hygienist more than they see the dentist. I mean, hopefully, right?
Yeah.
Nobody wants to really see the dentist. So that means if you're seeing me a lot now as the dentist, we're doing a lot of work together. So hopefully you're seeing the hygienist more than me. But, the hygienist really is frontline. And
Mhm.
that is where, an ASAP. And as far as a provider list, we do have a provider list too for people looking for someone that is airway minded, that's going to put you in the right, get you in the right direction. Who do you need to go to first? Maybe you need to see a myofunctional therapist. Maybe you need expansion and correct all the decompensations, see the ENT. So, I think I totally agree with you. I think the good change I'm seeing is awareness. Whether we like it or not, I think social media has everything to do with that. I think I don't even know. I can't even imagine my life without social media, like all the information. I mean, we did live
Yeah.
without social media, Kelly. And
We
it's
did, we
like,
did, we
we
did.
did. We lived without social media.
Yeah,
And
it was
and
a
it's
little
like,
harder to learn all the
yes.
information.
And so as much as it is
Yeah,
frustrating and there's a lot of
yeah,
poor information out there, but there's also some amazing information and we can educate. We can do things like this, like have a podcast and just talk and have a conversation. What are some of the some of the obstacles you're still facing right now or you're still seeing right now that you're like, gosh, if we could just, wave a wand and change this, things, things would seem better or, we would be moving in the right direction.
my wish is that teachers in second grade, first grade could learn what the airway dentists are learning and take the kids in their class who are having a hard time in general, learning with inattention, impulse control, all the things that they're not getting, emotional regulations, what they're not getting if they're not spending enough time in REM sleep, which is the back half. They see this. And I have a heart for teachers. My mom was a teacher, my dad was a teacher, and I know that when you have a class of kids, you have to teach. And when you've got some that are maybe kinetic learners or they have the symptoms of ADHD, but really it's just the cortisol that's just still in their body after being in fight or flight all night, and they're having a hard time controlling these kids and helping them sleep, that these teachers could learn the signs and symptoms of sleep disorder breathing and mouth breathing and be aware of that and have an avenue to say, okay, this this child is mouth breathing throughout the day. I know that this is something that if the parents were aware and if I could have a specific provider to send them to, then I would be able to help this child sleep and breathe better. Because the one thing that happened is after I spoke with Dr. Moralia Ben and we got him fitted for a breathing retrainer at night, it was over Christmas and it was so funny because we had the kindergarten teachers. We had the one that was super outgoing and the other one that was helping us detach from our kids when we drop them off. She's just all business, like, okay, bye,
Yeah.
mom, and bring them in. That's what's supposed to happen. And she was a really a deep thinker. And so during at the first half of the year in kindergarten, when we had our parent teacher conference, she was saying, Finn seems really tired. And I was like, huh, I've never heard anybody say that. Um, because everybody sees the hyperactive behavior that all of that's happening because he wasn't able to sleep. So that was at the like the beginning of the year. And over Christmas we had him fitted for a breathing retrainer. And so he was we were helping him over Christmas begin nasal breathing while he was sleeping. And he had his first night during that time period during Christmas break that he actually slept fully through the night, like the entire night. And I will never forget it because he woke up and he, first of all, just like seemed refreshed, but he was so excited to find our yellow cat. And we're like, we have a black and white cat, but we don't have a yellow cat. And there was nothing in his that you could tell him that we didn't have a yellow cat. He was so excited to find this cat. And it turns out that he had actually had his first real dream.
Wow. So it felt, he's like, but my mind saw a yellow cat.
Yeah.
This
And if,
thing is called a dream, right? He's
yeah,
never really had dreams.
no. And
Wow.
it's and even if you ask parents, like for a long time, I was breathing it through my mouth, and I was like, I don't remember the last time I was dreaming. And now that I'm a nasal breather, I dream a lot, which is, it
It's
helps to tell
impactful.
parents what's going on, teachers what's going on, so everybody gets better sleep and has more patience. But
I
at the same time, being able to help these children, and so and but teachers have a lot on their plate.
They do, they have a lot on their plate. the thing that I wanted to back up because I think that was really, I think this is what's missing big time. Yes, we need more dentists doing this. The ADA, the American Dental Association, is right on.
Yep.
This should be a part of standard of care of, screening, asking questions in health histories. Yes, 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 yes. Yes, a dentist sees a child, a patient, on average twice a year, and the medical doctor may not see them, but maybe once a year, or
Right.
sometimes if that.
Yep.
Unfortunately, people don't always go to their wellness exams. They might go to their dental visits before they go to wellness exams.
Yeah.
But who sees that child every single day?
Hmm.
Their teacher.
Yep.
So if we could get the educational system understanding that some of these learning issues,
Hmm.
some of these behavior issues
Yes.
are sleep and breathing related.
Yes.
If we could get the educational system
Uh,
connected with an
yep.
airway dentist, an airway minded ENT, an airway minded,
Yep.
primary care physician, think of the impact.
Oh, yeah.
Think of the impact, and it's so the question is, listener, are you a teacher
Mhm.
out there
Yep.
in your community? Like listening, is there a teacher listening right now? Your impact on these
Mhm.
kiddos' lives, the kid who has their head on the desk all the time, boy, that kid is exhausted. But
Mhm.
you know what else a tired child looks like? The one that won't sit still,
Yeah, that's
the
right.
one that won't listen, the one that interrupts all the time, the one that looks like they're operated with a battery that never ends. Like
Hmm.
they're like the Energizer bunny. That kid's tired too. And
Yeah.
they're doing everything in their power to not fall asleep. So if we could get the educational system to be on our team with us, and it's not that they don't want to be, it's they don't know about it.
You don't. Right.
So it's how do we get, wow, even, my local sleep physicians, we've talked about, before a child is ever put on ADHD medication, they should have a sleep consultation.
Yes.
For a child, children with Down syndrome by age 5
Hmm.
should have a sleep study because such a high rate of children with Down syndrome have
Yep.
obstructive sleep apnea.
Yeah. Yeah.
These school start times are too early.
Oh, yes, they are.
These kiddos are missing
Yep.
the very last stage, the last cycle of sleep. And
Yeah.
what's interesting too is, there's a natural circadian rhythm
Hmm.
and it changes as we get older. And, teenagers start staying up later.
Yep.
That is natural
By design.
by design. These
Yes.
teenagers start, so kids need, little kids, you can get, there's a nice little map of like how many hours of sleep a baby should get, a toddler should get, an elementary school child should get, but teenagers should get
Mhm.
8 hours plus, but at least 8 hours of sleep would be great, but they don't go to bed naturally
Right.
till later.
Yeah.
They don't feel sleep pressure till 11 o'clock plus
Right.
10:30, 11. So when you're telling them to wake up at 5 because they
Mm-mm.
got to catch a bus by
Mm.
6, and then class, the bell rings at 7 or
Ugh.
6:45, they
Yeah.
should have been in REM sleep at that time, their
That's right.
final longest stage of REM sleep. So we have a problem with school start times. We have a problem with the education system because now they're like, well, parents go to work by a certain time, so they need their kids off to school because they're at work. And I mean, it's just we've got so many issues, but it starts with conversations. It starts with these discussions. It's definitely not going to change if we're not talking about it.
Well, if I get on that topic, it's funny because with teachers after that Christmas break, just bringing it back around to Finn having that dream and all of that. My husband called and he said, the teacher, the one that we were talking about, I'm not going to name names. I mean, she's amazing, but he said she came up to me. She actually sought me out. You know, the one that separates your kids, the one that's all business. She goes, she came up and she said, "What have you done differently?
Mm.
Your kid, he's different now." And so she was like, "What was it? Medication? What are you doing differently to help him?" And so we were able to share with her that her comments on sleep were right on. And but it was just like, oh, she spoke to me and she wanted to know. She was so intent on finding out what we had done over the Christmas holidays to help Finn be able to sit through class better.
Well, it
And
was such a difference. So for her, it's like, what did you do? It's
yeah,
different. There's such a difference.
yes,
I know
yeah.
we got to wrap up here in a minute. Um,
Can I make one more
you,
comment about the
yes, no,
breathing
I was
routine?
going to transition into some things about this. Keep going, Kelley.
Okay, so the one thing I do want to say is that we did get the breathing retraining with the at night taken care of, but had I stopped there, I would have missed the boat on an important stage of growth and development. I had soon after he started the breathing retraining, I met Dr. Kevin Boyd at the Dawson Academy, and I'll never forget Whit Wilkerson coming in, Dr. Wilkerson, and he's like, "Kelley, Dr. Boyd is going to be here tomorrow, and I think you want to meet him." I'm like, oh, Dr. Boyd is coming in. Of course, I want to meet him. But when I was talking to Dr. Boyd, and he said, "Well, show me a picture of Finn," and I'm like, "I'm not here to talk about my kid." And he's like, "We're not talking about anything until you show me a picture of your kid." And so I showed him, and he's like, "Okay." And he started to look at some of the pictures and was like, "Look, we've got to get this. We've got to get something structurally different with him while we can still move the maxilla forward." So I was like, I'm on board. So because we got the nasal breathing, but then we did the expansion and the reverse pull face mask, and to be able to get him. So it's not just stopping with the breathing retraining. It's all of the things that are done mechanically if we don't have the tongue in the roof of the mouth, being able to do that. So there's modalities. And let's say we pass that stage where you can get that done non-surgically or without
More mechanical
ease.
forces. Yeah, yeah.
Right, sure. So yeah, so then we were moved on to Dr. Kevin Boyd to do all of his expansion. And that's where I learned the phenotypes of sleep disorder breathing that he put into a presentation. We turned that into a flip chart so that teams can have that so they can learn it and teach patients. And that's where I put some of those phenotypes into the very stuffy nose
Well,
so that
that's what I
um
was going to say too. You have those phenotypes in the book, and the
yeah,
book. So if people want to get your book, it's at superbreathers.com, and you
yep,
have a place for them to get the book. And there's
yep.
some educational aspects on there too. You have a lot of great stuff on there too. I'm putting all this in the
Okay,
links in the
thanks.
podcast. So
Yep.
superbreathers.com. You're on Instagram, super underscore breathers, and then Facebook, super breathers.
Yep.
You're also on LinkedIn, which is where I of course saw you. But um, I think if you could, speak to, I mean, it's like if we could speak to the dentist, we would say, learn this, right? The dentist that's listening right now, that's like, I don't know, we just weren't taught this in school. And
Yeah.
the thing that makes orthodontics different for someone that's more airway minded,
Yep.
um, is we're looking kind of at apples and oranges. So there are different, and it doesn't make, this is what I want people to understand. Like an orthodontist, that you might walk into an orthodontist office and they're going to give you a treatment plan.
Yep.
But what are their goals? What's their diagnosis? Their diagnosis might be, I'm not looking at a cone beam. I'm not looking at your airway health. I'm
Mhm.
looking at what we are taught traditionally, putting the white things together in a certain, and when I say the white things, the teeth, we're putting
Yep.
the teeth together, and we just want these teeth to fit together a certain way. And
Yep.
here's your treatment plan to make these white teeth, fit together a certain way. That's
Yep.
not wrong. That's
No,
not
it's not.
wrong. But the question is are they asking the right questions? Are they
Mhm.
asking if a child is breathing well, sleeping
Mhm.
well?
Yep.
And then that opens up a different diagnosis potentially. If you're just
Yep.
wanting your teeth to be straight and you're sleeping great like a rock star and you don't have any issues, then that's a great treatment plan for you in your
Absolutely.
life, right?
Yep. Yep.
But we're just asking that more, and you know, if you don't want to do the airway minded treatment plans and you don't, then at least refer to somebody that is and is getting the education to be able to look at, okay, we're looking at where the soft palate is hanging in that airway.
Yep.
Okay, maybe, and where's the collapse? Maybe this airway dentist orthodontist actually works with an ENT or a sleep physician or
Right.
an oral surgeon that does DISE, which is drug induced sleep endoscopy, and they know that there's a collapse. They see where the collapse is. Now we know where the anatomical obstructions are. And now the orthodontist has a different diagnosis. Now the dentist has a different diagnosis. Now the
Right.
treatment plan is different. It's different than just putting together
That's right.
teeth and
Yep.
making sure they bite together okay. And when you smile,
Hmm.
they look pretty. And speaking to the medical professional, right? You know, just we need more conversations, and your oral physicians in your town that understand this have a seat at the table. What
Yep.
would you say, Kelley, to the parent listening right now that's maybe on the journey where you were for 6 years, where you had no answers? What do you
Yep.
say to them?
I would say that one of the areas that I think is telling is, does a child have dark circles under their eyes? When you look at them straight on, do you see the whites of their eye under the iris? And when you look at them, I went back and I have thousands of photos of Finn, just Finn being Finn, and you can tell that he's a mouth breather. I don't even have to watch him. I can just look back at all of it. And I see a lot of people on Facebook posting pictures of their kids, and I can tell that that mouth is commonly open. This
Open.
it's there, it's open. So just looking back at the photos, if you notice that your child is breathing through their mouth, then you probably want to seek out at least the advice of a doctor that has, or an orthodontist or a dentist that has airway as part of their protocols. So Ben now is doing treatment with Dr. Drew McDonald, who is, he is amazing. He's in my town.
I
He's
love
in my
Drew
study club.
McDonald. Yes.
And because we still had a trapped canine, so we needed to bring that down. So we had Dr. Minari take care of that. And then, so now in our study club, but Dr. McDonald also noticed that Finn had a little bit of a joint that needed to be properly seated. So now he's doing his orthodontics to seat the joint, to CR, so that we can then have a good occlusion at the end of the day, because all this expansion can be a little asymmetric. And also, he fell out of the bed with a reversible face mask on. So I thought, okay, we're probably going to have to address a joint at some point. But we also have other orthodontists in my town. One is in another area, and they do really great airway orthodontics. So we have them kind of spread out for to be able to refer to. But we also have an orthodontist who comes in to learn more, and she refers to Dr. McDonald or to the other orthodontists who are doing airway. She's aware, she's not ready, but I would like to see, as part of the photo diagnostics that you take, that you just take one more photo, and that's of the tongue. And
Mm.
if that tongue has indents, if it's scalloped, then you consider not retracting, because the tongue is already telling you, I don't have the space. So maybe
Oh,
you,
look at we got a visitor behind
so,
you. Sorry.
well,
I love it.
Ella, Ella is in the Very Stuffy Nose. She's on every page. She's got a lot
Well,
going
look at
on.
Ella,
So
you
she's like,
little,
hey, don't forget to mention me.
somebody's a camera hog over there. She, that's so cute. I love
Hilarious.
her entrance. But yes, the tongue. If it's scalloped, it's telling you a story. I was actually
Yeah.
I had a podcast a couple weeks ago with Maz Moshiri and Reza Movahed.
Oh, yes.
And
Oh,
and
yes.
Maz was like, you know, I'm really starting to look more at the tongue, like, you know, making the tongue more of a centerpiece. I mean, this
Yeah.
tongue, this muscle is the
Yeah.
driving force of growth. It is either the best orthodontist on the planet or it
Yep.
is a train wreck orthodontist. Like
That's
it's
right.
knocking teeth out of the way. It's
Yeah.
also a beautiful retainer. So
Absolutely.
why aren't we making this more of the centerpiece of our
Yep.
treatments
Yeah.
So you're right. Like, look at the tongue. We need to start looking at the tongue. And, I think more information and research is coming out about the tongue, just from so many different, even neurological standpoints and how
Hmm.
vagal tone and everything. Um, I appreciate you being in here, Kelley, and telling your story. And I'll have all those links in the podcast for people to get to you, your website, your services. You have services you offer, with aligner workups and things like that, as well. And your amazing book to educate. And wow, what if we could start getting some of these books into the educational system just to start a conversation? The Very Stuffy Nose.
Yeah.
It's a cute little book. I think you said it took you a couple years in the making. And I noticed too, it's in many languages. I saw that you have
Mhm.
it in Spanish, you have it in German, um,
Yep.
and I don't know how many other languages, but it
We've got it in French and we're coming out with Polish soon. So,
very,
yeah.
very good,
Yeah.
friend. I love this.
Yes.
Um, I was going to do a little ASAP housekeeping really quick. For those of you who want to know what's up with ASAP, just, sign up. We got a link to sign up for a newsletter. We can fill you in on what we're doing. And we do have a provider directory. So if you're looking for somebody to help you, go to our provider directory. We have courses. We have one more course the end of the year, December 16th. It's virtual. It's from 8 to 10 Eastern. It's the MARPE clinical updates. So it's all the, things that can happen during MARPE expansion. Ilya Lipkin is leading that, and you can take that in your pajamas. You don't have to be a member to take it. We also have the Practice Breakfast Club. We meet once a month. We talk about the business of how to implement this, because if you can't implement this kind of stuff in your dental practice, then you can't help people. That's the bottom line. We also have mini residency coming up in 2026. We have 4 courses in our mini residency pathway. I'm really excited about that. And we also have an aligner mastery course in April and October. How to do aligner therapy for the airway compromised patient. Ilya Lipkin's helping us with that one as well. And if you want to be a member, we do have different options. You can dip your toe in the water and become an immersion member, ASAP Immersion. We meet once a month. You get all of our educational online modules, and we get together and we talk and we chat. Or you could become a comprehensive member and you get everything, which includes the immersion. But just had to do my ASAP housekeeping. But I have my 3 questions for you, Kelley, so you're not off the hook. I'm not
Oh
done with
no.
you.
Okay.
Here we go. What is your favorite pizza topping combination?
Ah, that's easy.
Ooh,
Green peppers, onions, and black olives.
ooh, so you're like a
Thin
veggie
crust.
pizza. Thin crust?
Yeah. Well, New York style crust, not too thin,
Oh,
but New
okay.
York
Yeah, I'm
style.
from St.
Yeah.
Louis. When you say thin, we have like cardboard paper
Oh,
that, yeah.
that might
Yeah.
be too thin.
Okay, so that's a St. Louis style pizza is paper thin.
That's good to know. That's
Yeah,
good to know.
so okay. That sounds delicious.
Yes.
I love a good veggie pizza, but I also won't turn down. I'll eat all of that, but I will not turn down if you had some hamburger or even pepperoni on there. Uh,
Yeah.
that sounds delicious to me too.
Yeah.
What is an animal that you are afraid of and you don't really know why?
Oh my gosh. Ah,
Like if somebody like said, "Hey, here, hold this," or "Look, oh, look over there.
ugh.
It's
It's going to be a
whatever."
tarantula all day long. Ugh. Oh, no. No, no, no.
So you're not a spider person.
Uh, no, I'm not. A little spider I can handle, but I don't know what I would do if there was a tarantula in my house.
Oh, or those
I
big wolf
would just
spiders.
leave and then send someone in, I think. No.
To me, that's rational. I think you hear more people with, I hate snakes. Ugh, like,
Yeah.
oh, I'll see a spider, it'll give me the heebie-jeebies. Like, I was I was hanging out with my cousin a few months ago, and I felt something on my leg, and I flipped the
Oh gosh.
blankets back on the
Oh
couch. We were
no.
just having coffee, and man,
Yeah.
that sucker was huge. I mean, and I will say, I mean, I flipped a bit, and I mean, I was saying some words, and I don't know where that thing went, but I'm like, that is going in the washing machine to drown
Oh gosh.
whatever else was living in that blanket. But
Yes. all day
That to
long.
me is a rational thing, but I'm gonna throw my kids under the bus a little bit here. But my sons totally freaked out. My one son, Judah, he does my transcript, so he's gonna hear me say this, but he is frogs.
Oh, yeah.
Frogs.
My husband doesn't like the frog. Yeah.
Well, and I'm like, why? It is cute. I'll grab
Yeah.
a frog in a heartbeat. He's like, they don't have teeth and they're like squishy. And I'm like, right. And then my oldest son, who's 22, fish. Like, if you want to see him walk on water, let a fish touch his leg. I mean, that guy is coming up out of the water, and it's
Oh my
interesting to
gosh.
me, but he's like,
That
it's
is
their
funny.
eyeballs. It's their
Wow.
big,
Okay.
anyway, that is, to me, that's
That's funny.
irrational. But
Yeah.
your spiders make sense. Okay. And I don't know if you've ever experienced this, but what is the weirdest way someone has ever mispronounced your name?
I don't have people mispronounce my name, but there's a bunch of different ways to spell Kelly. And because it's always been in my email, I have had to tell, like, if I have, so for right now, like, my email is kelly.richardson@candico.com. So if somebody doesn't put the E in, I think I asked when I started, could we create a dummy email that if somebody sends it Kelley dot Richardson, then I'll still get the email. Because if I get a call from one of my accounts that says, "Hey, we emailed you and you really never got back to us," and I'm like, "Did you put that E in there?"
Oh, girl, I am with
So,
you on that because I'm a Stacy, no E.
right.
So I get the Stacy,
Yep.
Eyi,
Yeah.
I get all kinds of weird spellings of my name, just like you. And Tracy is
Yeah. She's
Tracy.
an EY, right?
She's an EY. So
Right.
I'm just the Y.
Yeah.
And sometimes people call Michelle Shelley. And
Oh my gosh. So
yeah,
that's,
so I'm
yeah.
just
I
like,
was gonna say Dr. Michelle has it. She's golden,
yeah,
but
but some people
obviously
call her
not.
Shelley, which I can't get myself to call her Shelley. I'm like, I don't even know who Shelley is. But sometimes
No,
Tracy
she's
calls Michelle Shelley. I'm like, who? She's like,
oh funny.
Shelley. I'm like, who's Shelley? She's like,
Oh gosh.
Michelle. I'm like, I've
That's
never
hilarious.
called her that. But I do get
Yeah.
people will say Daisy. They think I said Daisy.
Oh.
And I got it again yesterday. Someone said, hey Daisy, we're returning your call. I'm like, oh my gosh. Oh yeah, so interesting. That's like a mispronunciation of my name, but I'm with you on the Stacy no E and you're the Kelly with an E, so I understand it.
Yeah. That's so funny. Yeah, that's
Well, I appreciate you being here today, Kelly, and for being a warrior mother, just being in the practice trenches and helping people and educating communities and educating parents. And you've helped many people on your journey as well. So I hope today's conversation, we help one more family, and make
Amen.
some
I'll tell you,
changes.
I've had mentors. You and Dr. Stacy, I mean, Dr. Michelle and Dr. Tracy have been my mentors. I got to learn from you when I spent some time helping you guys with some courses. And you guys are leading the charge. When I remember when ASAP Pathway came out, and I was like, finally, like your tagline, because kids can't wait, was they can't.
Yeah.
So anybody that is looking into getting their children treatment, just stop what you're doing right now and prioritize that. Put it on the top of the to-do list because it matters when you get treatment. And you can treat children, you can treat adults, we can treat everybody for something, but it's just easier when it's earlier.
It's
So,
easier and
and
so much
yeah,
more impactful long term. Um,
yeah,
you intercept early. So,
yeah. And can I throw out one other thing?
yeah.
Dr.
Oh, I love
Susan
Susan
Maples.
Maples.
Okay. If you're not sure you're ready, she's gonna answer all your questions in this book.
Love
Like,
Bra I've had Susan Maples on.
I've
She
heard.
is fantastic. The
Ugh,
Brave Parent. She has a podcast, Brave Parent Podcast. Hold on, I'm adding her to my list of
yeah.
mentions in this podcast. She is fantastic. So yes, Brave
Yep.
Parent, and it really is brave parenting. And yes,
And so both, but I mean, we created the Very Stuffy Nose book to drive people to your practices so that parents could understand the importance of nasal breathing. But at the end is our story. It's basically about if you have a restless sleeper, you need to find somebody that can help, and we're going to be able to help you with that instead of just leaving somebody hanging. Okay, well, that's a cute story, but if you read our story at the end, it's really to drive the awareness that there is something that can be done, and now you're aware, and you go from unaware to aware, from unconcerned to concerned when you do meet with the airway provider, and they start to point out how they can really affect so many points that lead to a different, higher quality of living. So I hope that my book has been able to help people know what I didn't know and be able to find a provider that can help them that night so that they can start sleeping and breathing better.
Well, it
And
has
I
a
am
call
so
to
appreciative for
action.
what you guys do.
Absolutely. Well, we
So
thank you for that. Thank you very much for that. And because there's some days the three of us are texting at like 11:30 at night about things that we have to do, and we're like, oh, thank God there's three of us. We probably say that every week. Thank God there's three of us. Thank God there's three of us. So
you
yeah,
guys have such an interesting dynamic that you are able to bring so many different pieces together just by your relationship. So I think
we
that it's just admirable to see how you've all come together, and you bring your special part of, I mean, Dr. Michelle's got the TMD piece of it, and Dr. Tracy has she's just so good with research,
oh, she's
and
very
you can
amazing with
just get the
research.
word out. So
Well,
I
it
just love
takes
what you're
all of
doing.
us together, including you and including people listening. It takes all of us,
Yes.
and but I am appreciative for them, and I am grateful there's three of us, and I am so we also say we're so shocked we still love each other and we haven't killed each other. That is very real. So I mean, we get really frustrated times, and it's like a couple of days will go
Yeah.
by and we're like, I still love you, you know. We have our days, but thank you
Yeah.
everybody for listening and taking the time to listen, and maybe share this podcast with somebody you know if you think it's going to be helpful. So thanks, and we'll see you all again next time. Thanks, Kelley.
Thank you.
This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, Ben, Lydia, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.